Good afternoon, everybody. Today is April 16th, 2021. My name is Scott McGann, doing your weekly COVID-19 update for the town of Falmouth. The website for Falmouth and for COVID information is most up-to-date is falmouthma.gov. That's the town website. There's a COVID link. Email the health department at health@falmouthma.gov, and 495-7485 is our phone number. That's not for vaccine appointments. That might be for COVID complaints, general questions, and so forth. And also there's the county call hotline at 774-330-3001. We're going to start off like we have been with the vaccines. Current eligibility changes on Monday, so all of you that have been patiently waiting under the age of 55 with no comorbidities, you are eligible as of Monday. As we go through this, you have to keep in mind that whenever a new age group or a new phase kicks in, that there is going to be a bottleneck. It doesn't mean that there's tons more vaccine available. So I think there'll be a bottleneck, at least at the beginning, until people find the vaccine. So just be forewarned when you start looking that it just not maybe the opportunities are going fast, because that's what's happened each time we've added a new group of people that are eligible. And this is a relatively large group that you're going to see a little bit of difficulty within the first couple of weeks, and then it generally works its way out in a few weeks, and that's what you're going to see here. So you'll have to sort of keep working at it in order to get an appointment, and things just get better through time. So how do you get registered? Well, if you don't mind going to the mass vaccination sites, such as Dartmouth or Gillette, you can pre-sign up at any time. On the site looks like this on the right. Just pre-register, and you'll get an email 24 hours notice whether you want to accept the appointment or not. So that's one way that you can do it. You can do that in your leisure, then you'll be contacted. So that's if you want to go to the mass vaccination sites. Okay. Locally, it's still relatively limited. So Barnstable County's still getting their 3,500 per week dosage. It's being rotated through the sites, so we had a couple at the fairgrounds the last couple of previous weeks. Four Cs is going to be the Four Cs. Cape Cod Community College will be the main place. They'll also do some in Orleans at the DPW. Those go up. Those go up, and then they're registered through an online registration system, which they're actually going to enhance with the state new system. Hopefully it's better, but right now you would just go on there. We put the press releases on our website. Also, you could just, by going on barstablecountyhealth.org, you can just simply, last time I was on there, it popped right up. Do you want to be notified of upcoming? So they'll have that as well. So that's really sort of stagnant. That's sort of where we are. The biggest change has been with the Community Health Center of Cape Cod. All the community health centers are seeing both federal and state doses. They're seeing the largest increase. The Community Health Center will be working on doing larger clinics. I just don't have a lot of details. It's being worked out now. But they're seeing a big increase in doses, so they need to sort of pivot to be more of mass vaccinators. So you'll start seeing some more stuff from the Community Health Center of Cape Cod. Same thing's happening with Out of Cape Health down Cape. So as the community health centers are seeing it, you have to sort of go with the hot hand, and the Community Health Center is going to start doing things a little bit differently than they normally do, and work on having larger clinics. And as soon as we get the information and the details, we'll post it to our site. Those should be media blasts and so forth. The other biggest increase, and it's been like this for a while, are pharmacies. So your CVS's, Walgreens, Osco, and Shaw's, places like that, some Stop and Shops as well. Pharmacies do see a big increase. They're directly in with the Fed, especially Walgreens and CVS. Some of the other pharmacies get it from the state. But the pharmacies do see the largest increase, a large increase in doses, so that would be another place you keep looking as well. And they're sneaky good at doing it. If they're at 25, 55, whatever they're doing a day, really does add up. Cape Cod Healthcare is still doing it. I'll talk about that in a second. They're using the Melody tent the last few times that they've done it, so they have a drive-through over there. And of course, veterans, if they can't get it locally, can always go to the VA, but that would mean a trip out to Brockton or West Roxbury or JP for that, so Jamaica Plains. So that's some of your options. And of course, again, when the community health center and things get solidified, then that'll be definitely be blasted up. Okay, so the Cape Cod Regional Vaccine Consortium, that has not changed. If you're over the age of 60, in a couple of slides, I'm going to show you vaccination rates. So if you're being left behind, you're over 60, you're having trouble with the online, you need to call the senior center. We've been very effective dealing directly with Cape Cod Healthcare. Provide your name to them. They'll call you for for a time, for an appointment. So if you're struggling, especially you should be doing this, and I tried to emphasize it last time, if you've listened to me, is to do it now, because as we open up to everybody, obviously it becomes more and more of a demand. So anybody who's struggling at that age, 60 or over, need to call the senior center. Homebound, also always call the senior center. We have a program with the Community Health Center of Cape Cod. They go out and do homebound. We've gotten through the list that we've been able to find. Obviously, we do have people that come out. We do find new people here and there. Again, call the senior center. Second dose appointments should be an automatic thing, depends on who you register with, but there should be another email that comes to you. You can either do it on site, like some of the sites, at the same day. Sometimes you have to wait for an email, but other than that, when you go get your first dose, you should find out directions for what your second dose is, because it might vary a little bit by who's doing the clinic. But if you're struggling to get your second dose appointment, you could call the health department or senior center. We could put your name to the consortium. We have a simple little survey that we could fill out and send with your information. Again, senior center's number is 508-540-0196. How are we doing vaccination rate? We're at a 6% gain in residents receiving their first dose. So we were at 50% last week. This week, the Barnstable County is at 56% with at least one dose, which is higher than any other county, which is great. Second dose or fully vaccinated is at 37%. That's a 5% increase. So we're making increases, and with maybe some additional doses going over to the community health, community health, the community health centers. You may see that then hopefully that percentage will go up. So we're making increments on 5 or 6% per week basis. Falmouth specifically had seen a 6% increase in first doses and a 6% increase in fully vaccinated, so we're now at 56% with one dose, 38% fully vaccinated. We're a 2% increase in first dose at 75 with a 7%, which makes sense. There's a delay, obviously, especially with Moderna being 28 days. We're 82% fully vaccinated at 75. 65 to 74, we're at 87 and 71. That's a 4 and 8% gain. 50 to 64 is now right at 2/3, an 11% gain. Again, obviously, their eligibility came later, so the numbers go down as you get younger. 32% are fully vaccinated over between age 50 and 64 for an 8%. Obviously, it's still 55, so it's going to be the younger 50 to 55. Once they're eligible, that number will start going up. That's starting next week. Well, probably next week, and especially the following weeks after that. 30 to 49 had saw a 9% increase of 45%. Some of that's got to do with food workers and reaching out to certain sector-specific workforces. That's probably where a lot of that increase had come from. With 24% or 6% gain fully vaccinated, 20 to 29 has seen a 9% gain and a 4% fully vaccinated. So we're getting there, 56% with 38%, so we're over 1/3 fully vaccinated at this point. And so you remember most people were only eligible. We really started doing general public after first responders on February 1st. So it's been since February 1st, and we've been able to gain these numbers. As clunky and difficult as some people have had to get their doses, we do seem to be getting there. So that's it for vaccine. Let's talk about COVID cases for the week. We have 1,472 total cases of COVID, with 37 during this past week, Thursday night to Thursday night. 123 probable cases since March 1st, with 19 this week. We're about 95% are no longer in isolation. We're about 11.2% of all cases. We've always been lower than the county for the most part. Contact tracing's never been better. We've there's more help at the VNA. We're really not using the state as much. We're really just doing everything with the VNA, which makes things a lot easier to keep it as much in-house as possible. We do both. The state has not let us know that we have both P1 and B117 variants have been found in Falmouth. So we know that the B117 is about 60% more spreadable, so to speak, and so what we're seeing in the cases are when it does hit a household, maybe it hit another person in the household under what we call, I guess you call the old school or the old COVID. The new COVID being much more spreadable, we're seeing more cases within that household, which is attributing to some of the increases in cases. So a family of 4 You might have had a second one become infected, trying to quarantine at home. Now you're getting 3 or 2.5. So you're seeing an increase there among clusters and among households. And it's probably part of it's got a lot to do with that B117 variant being more spreadable. In terms of our case count, you can see that we've had a 2-week decrease from that really bad week we had a few weeks ago. Over 90, we're at 37, so you see a downward trend. Hopefully that continues. You do see a bit of a downward trend among the county. We'll talk about that in a second. And as we vaccinated, I provided the average age since the start of the pandemic being 48.35 with all cases. The average since March 1st of this year was 40.3 with 279 cases. And since 4/1, this past month, the average age has dropped to 36.89, which was 91 cases. So you can see as the vaccine works, you're going to have it occur, and you'll see it in the state data as well. You'll see that the age will drop as the vaccine's eligibility, as the vaccine eligibility was mainly for those over the age of 50 until Monday. We haven't flattened our curve per se. We had a couple better weeks, but you want to see this particular curve to be really flat. The more steep it is, means the more growth we are, more cases we're having. We want to see that flatten out. And I think with the vaccine ramping up, and even with the variants that are out there, because we don't know without the vaccine, our cases might have been, going back to the previous slide, in an upward trajectory from the 90s cases that we had several weeks ago, because we had much more of the population with the ability to get it. So we know that the vaccines work, maybe a little less so against the variants, but we know that they do work. So it's probably helped drive that number down. So in terms of our color for the week, we remain yellow. We've only had 2 weeks in red the entire pandemic since they started to do this particular system, but that's been many months that we've had this in place. So we've done very well at the town level with our case counts. Our positivity had jumped up almost a full percent to 4.48. If once we went over 5%, we would have turned red, but we've been able to sort of knock it down to 3.78. So that's almost, that's 3/4 of a percentage point down. That's great. Barnstable County still Barnstable County, Dukes and Nantucket County. We're the highest. We're still the hot spot in the state, with Dukes and Nantucket being 8.3% positivity, Barnstable County being 5.14. But 5.14 is considerably lower than when we were a couple of weeks ago. So it is on a downward trend. The state average is 2.48. So normally, throughout most of the pandemic, Barnstable County did better as the state. It's been flipped over for the last month or so. With a couple of variants that we've had, the P1 and the B117, and so, it's going to take some time to knock it down. It is on a downward trend, though. You can see it again here. I show it in this slide. This is on the left is last week's update from the state, and on the right is the most current one from yesterday. I put a line at 30 per 100,000. You can see that most towns, or a good half the towns at least, were over 30 per 100,000 as an incident rate. You can see that most are below it, with Denison, Barnstable, and Yarmouth being over it, Harwich being right at it, and Brewster being right at it. So you can see that the trend is downward. So that's a great, it's going to take a few weeks for that to get really low. So that's where we're at with that. Cases, you can see here's all the cases, Barnstable County. You can see that we had the big spike again in January. We got down pretty good at the end of February, early March, but with the variants, we got back up with the Mid-Cape explosion, but it looks like we're sort of trending back down. And I think a lot of that had to do with vaccinations. I mean, that's really sort of cut that off and not been sort of a full-blown, even worse than January. My guess, we could have been well worse than we were in January if we had no vaccine around. Hospitalizations are leveling off. They were up as high as 30 back in March over at Cape Cod Hospital. You see now the Cape Cod Hospital is back in the teens. Not great, but still in the teens. And you see that Falmouth Hospital has got 4 and 3. So the trend is downward as the cases are downward as well. And hospitalizations should continue to go down in the state data. You see that as well. Again, vaccines work very, very well against severe disease, hospitalizations, and deaths. So you see that there was 5 deaths for the particular day. So we're staying under 10 for a lot of these days, which is great news. Shows that the vaccine are into the older people. The older people are, you can see in the cases are lower. You see even in the state, you see most of the cases being under 50, especially under 40, between 15 and 40. You see where most of the cases are. And so even though we've been averaging that 15 to 2,000 cases, we see less hospitalizations. the people that are severely ill is lower because it's hitting more of the younger population. Our trends are pretty good, pretty flat in hospitalizations. Positivities remain in that low 2s. Deaths are definitely on a downward trend. You can see there in the purple. Cases are starting to trend downward. That'll continue to trend downward. But again, to me, the most important things are hospitalizations and deaths. And that's where we're hanging in there, and also positivity. So we're in good trends there at the state. Just need, a few more weeks or a couple months maybe of keep hard vaccinating. Not a few more weeks. We'll definitely need a couple months, but you'll see the numbers continue to go down as time progresses, as vaccine comes out. So now, guys, one thing I didn't add a slide in, Johnson & Johnson was frozen for this week. The one clinic was scheduled by the Community Health Center. Was going to be Johnson & Johnson. They were able to do Moderna, so they didn't have to lose that clinic, but other clinics were canceled, and we'll see what happens with that. But most of our vaccine is Pfizer and Moderna here on the Cape, so the good news is that those two are still obviously being used, and we'll see with J&J. The blood clotting issue is in a low percentage of population, very low, and we'll let them decide what they want to do with the Johnson & Johnson. All the clinics are trying to fill with other types with the other two vaccines. But we generally saw a relatively low number of Johnson & Johnson here in Massachusetts. So, as far as testing hasn't changed. There's free drive-through testing at Barnstable County. You can go on their website to schedule it, capecodfairgrounds.org. It's not every day. It's usually just Tuesdays and Fridays, which may not always work for you. Obviously, you want to get tested when you want to get tested. Some pharmacies are still doing it, of course. CVS, walk-in clinics like Convenient MD does it a lot, the most in town. Community Health Center Cape Cod can do it. You can also go through Cape Cod, your physician. If your physician wants to schedule it through Cape Cod Healthcare, they have a dedicated call center. They still do that, so COVID testing has not changed. We've always been a town of well above average for COVID testing. We're still not at a point where with guidance is still the same as it's been since March 22nd. Nothing's changed guidance-wise. Nothing's going to change social distancing and diligent-wise until the numbers really crash on COVID cases, which, again, you still need more vaccinations for that to occur. Again, stay home when ill, self-isolated, get tested, continue diligent with social distance, face coverings, hand washing, hand sanitizing. It is school vacation week next week, so we have to keep an eye on that. As far as COVID cases, travel has always been an issue. Making sure that you quarantine, get tested, follow the advisory for the travel advisory that the state has. Again, more times you expose yourself, the more your risk goes up. So the more times you do things that you probably aren't supposed to do in terms of social distancing rules, then the more risk that you have. Things have probably changed as the cases should go down as we vaccinate more. The guidance will change, but right now nothing has changed in terms of that. So that's where we are. It'd be nice to know, especially with things coming up with fairs and festivals and all the pre-planning, what we're going to be able to do. But right now, a lot of it's not allowed. And so sometimes it's hard to tell what's going to be the guidance come June 1st, when the summer, especially July 1st, where we really get into our summer season. Where the guidance is going to be at that point. So if you're planning things like that, you're planning events, you're going to have to do maybe a last-minute decision on it just because the guidance is sort of lagging. I had a little indication from the state today that they would be eventually, but they're not at this point. So again, as a recap, eligibility is starting Monday, everybody 16 plus, okay, starting on Monday. Expect the bottleneck. You're not the only one that's going to want it if you fall into that category, and there's a lot of people that fall into that category, so it's going to take some time. Again, pharmacies, check our website, get yourself pre-registered at mass.gov, check Barnstable County's website, learn the state site, massimmunizations.org, get yourself familiar with how to do it, what you're going to do, and it will take a little bit of time. Our vaccine rates are good. They're similar to other Cape towns. We're all sort of in that same sort of ballpark. Metrics at the state level, as far as cases, are leveling off. Barnstable County is still very high in the state, but we have improved. Falmouth case count is 2-week downward trend. P1 and B117 are present. Regionally, we're vaccinating as soon as we get the vaccines with the Community Health Center and the pharmacies seeing the majority of the increase. It's pretty flat elsewhere, very flat elsewhere. And so the Community Health Center is going to work on doing some more mass vaccinations, and the details should follow by early next week. And so just stay tuned on that. And that's what we have for this week, and we'll see everybody next week. Thanks.